Hello everyone. Today we'll see the sterilization, the disinfectants that can be used for the sterilization in this post. The sterilization and the disinfection practices in a hospital is at most important in preventing the transmission of healthcare associated infections. By definition, sterilization is very important to know with the definition. It is defined as the process of complete removal or destruction of any forms of microbial lives, including the vegetative cells and their spores. So, what is the need for sterilization? The aim of all sterilization strategies is actually to kill or to remove the unwanted microorganisms. In certain cases, actually, the microbes are regarded as the potential pathogens, and therefore it is essential to eliminate these forms. Either it is in a vegetative form or a spore form of microbial life. All microbiological techniques require appropriate and adequate sterilization for the diagnosing or the diagnosis of the pathogens. So, by definition, the sterilization, the process by which an article, surface or medium is made free of all living microorganisms, either in vegetative or spore state. The agents which achieve the sterilization are called the sterilant, whereas disinfection is a process which reduces the number of viable microorganisms to an acceptable level but may not inactive some viruses and bacterial spores. The agents which achieve the disinfection are called disinfectant. Here you are supposed to know the antisepsis also. It is a procedure or application of an antiseptic solution or an agent that can be safely applied on the skin or mucous membrane, which inhibits the growth of microorganisms where asepsis can be maintained. Okay, so the definition is completed. You are about to know sterilization. What is sterilization? That kills about greater than or equal to 10 power 6 log colony forming units of microbes and the spores, that is sterilization. By disinfection, greater than or equal to 10 power 3 log colony forming units of most organisms will be killed, but not the spores, that is by disinfection. Okay, and we have different methods by which we can attain either sterilization or disinfection. Okay, the first is the physical method, and even by chemical method we can achieve the sterilization. Here we are going to do only the sterilants and the disinfectants that achieve the sterilization. By physical method, it can be classified as heat, radiation, filtration. Okay, heat has been further classified as dry heat, where hot oven is very important, and incineration is also important in the treating facilities. Flaming and also red heat is used in the laboratories. Moist heat, where temperature above 100 degrees Celsius is usually used by using the device called as autoclave in a laboratory and also in the central sterile supply departments, the CSSD of the hospitals. Usually temperature below 100 degrees Celsius. For example, pasteurization is also used, which is used in a commercial and also at homes also. The next category is the radiation. Radiation can be attained by non-ionizing infrared rays and the ultraviolet rays, and ionizing X-rays and the gamma rays. Filtration, by depth filter or membrane filter or air filter, we can to some extent reduce the number of bacterial colonies, but you should make sure that the radiation and filtration may not kill the spores. Okay, what are the chemical methods that gives you the complete sterilization? Or ethylene oxide and plasma sterilization. So by these two chemical agents, ethylene oxide and hydrogen peroxide, we can attain the cold sterilization process. It is a chemical mediated sterilization which kills the spores. We have other categories of disinfectants which has to be discussed here. Okay, this can be used in the surfaces or in any devices, but that may not kill the spores again. They are classified as high level disinfectant, intermediate level disinfectant and low level disinfectant. This category is based on the Spalding for medical devices. So high level disinfection is used in an area like critical devices, and intermediate level disinfection is used where semi-critical devices are used, and low level disinfection are used where non-critical devices are used. Critical devices are the one which has a direct contact with your bloodstream. Semi-critical devices are used where we have the mucous membrane like area, and non-critical devices are the one which are used for your skin or in the surfaces. So here must to know is what is CSSD. It is a Central Sterile Supply Department where we will have a decontamination area, packaging area, sterilization area, sterile storage area, and it is an integrated place in a hospital that performs sterilization of medical devices, equipments and consumables that are used in the operation theatre of the hospital and are also used for some aseptic procedures. Okay. And what are the factors that influence the efficacy of disinfectant or sterilant? First is the organism load, nature of organism, concentration, contact time, temperature, stability, pH of the disinfectant or the sterilant, relative humidity of the environment, organic matter whether it is present or not, and the biofilm, the virulence property ability of the organism. What are the properties of a ideal disinfectant or sterilant so that it can be used commercially? Is it should have a broader microbicidal activity, first one. Second, fast acting, time based activity is very to be effective, and it should not be affected by any environmental factors. It should be non-toxic if it is used in a living tissue, and compatible with the surfaces or with any materials. It should be odorless or giving pleasant odor. It should be economical and environmental friendly also. Under physical method, first we are going to see the heat, that is the dry heat. With the dry heat, we have different types: red heat, flaming, incineration and hot air oven. Under red heat, the red heat is used to sterilize the metallic objects by holding them in flame till they turn red hot. For example, the inoculation loop that is used for transferring the specimen onto the culture medium. Okay, and the needles, the forceps, all can be sterilized by red heat. Next is the flaming. The article is passed over flame without allowing it to become red hot. For example, the glass plates, cotton wool and the glass slides, all these can just go for flaming. Okay, incineration, for safely destroying materials like contaminated cloths, pathological materials for up to 1200 degrees Celsius is incineration, and they result in ash. So in treatment facility, the biomedical waste treatment facilities also we can have the incineration, where it has a very tedious protocol again to follow that incineration procedure. Hot air oven, it is used to sterilize items which do not get damaged by high temperature. For example, the glasswares, including the petri dishes, glass petri dishes, flask, beakers, instruments with sharp cutting edges, and then the powders, the Dapton dishes, mouth mirrors, all the oils, all should be sterilized only by hot air oven. Okay. The temperature that is maintained in hot air oven can be ideally 160 degrees Celsius for 60 minutes. Okay, it can be varying. If the temperature is decreased, time can be increased, and the temperature is increased, time can be decreased. And already I have told you what are the things that can be sterilized by the hot air oven. Next is the moist heat sterilization. The moist heat sterilization can be of temperature below 100 degrees Celsius, temperature at 100 degrees Celsius, and temperature above 100 degrees Celsius. Pasteurization and inspissation. Pasteurization is the one used for milk pasteurization, and inspissation is the procedure used to sterilize the medium containing the proteins. For example, Lowenstein-Jensen medium, which is used as a special media, the isolation media for Mycobacterium tuberculosis, is sterilized by inspissation procedure. Next is the temperature at 100 degrees Celsius. At home also we used to have a boiling. Steam at atmospheric pressure. Tyndallization, the intermittent sterilization, all comes under temperature at 100 degrees Celsius. Next is the temperature above 100 degrees Celsius. For example, we have the autoclave, which works under the principle of steam under pressure. Temperature above 100 degrees Celsius, the principle of autoclave is The water boils when its vapor pressure equals that of the surrounding atmosphere. The atmospheric pressure is raised, boiling temperature is also raised. At normal pressure, water boils actually at 100 degrees Celsius, but in a closed vessels like an autoclave, the temperature of water boiling also increases. Okay. The components of steam sterilizer include the pressure chamber, the large cylinder. It can be of two types, vertical or horizontal cylinder. It will have a steam jacket, the water compartment at the bottom usually, and the lid, which usually have a pressure gauge, the tightening agents, safety valves, and the electrical heater that to be there in the steam jacket also. The procedure involves three phases: the conditioning phase, the exposure phase, and the exhaust phase. The procedure is the material to be sterilized or placed inside the cylinder. The steam jacket is filled with sufficient water, usually the distilled water, because the normal water can cause rust in the cylinder. Lid is closed and the electrical heater is put on. The sterilization process then starts. In the conditioning phase, initial phase, or after the water boils, the air in the chamber is completely displaced by the steam that is produced. The steam pressure rises inside, and when it reaches the desired set level, that is 15 pounds, 15 lbs per square inch, the safety valve opens and excess steam escapes out. From now, the holding period starts. That is said to be the exposure phase. The holding period is counted from this point of time, which is about 15 minutes in most of the cases. For molecular laboratory, the holding period is 1 hour. Next is the exhaust phase. After the holding period is over, the electrical heater is switched off and the steam sterilizer is allowed to cool till it reaches the atmospheric pressure. Then only we have to open the lid. Otherwise, you may result in a breakage of the materials which is kept inside. What are the uses of steam sterilizer? Steam sterilizer is most commonly used sterilization method in the hospitals, of course. All critical, semi-critical items that are heat and moisture resistant, like surgical instruments, anesthetic equipments, dental instruments, implanted medical devices, and surgical drapes, linens, all can be sterilized by the autoclave. And next is the culture media also can be sterilized by the autoclave. The biomedical treatment facility, okay, the waste treatment facility of waste and the sharps which can be recycled, also can be sterilized by the autoclaves. Types are of two types, which is based on the cylinder. One is horizontal type, that is usually used in the CSSD, which I have told you before, the Central Sterile Supply Department, and the vertical type, which are mainly used in the many cases of laboratories. What are the advantages and the disadvantages of steam sterilizer? Is advantages: it is of low cost than the ETO, ethylene oxide sterilizer, and this plasma sterilizer. It is fast compared to ETO sterilizer. It is non-toxic and leaves no byproduct behind. No, unlike ethylene oxide byproducts. Disadvantages are heat can damage acrylics and styrene, PVC materials, and corrode some metals also. Higher temperature for a prolonged time can harm or shorten the life of instruments. Moisture also can adversely affect electronics and can cloud the sensitive materials and leave watermark stains on them. So for any kind of sterilizers, the sterilants, okay, we use three types of indicators, whether it works properly or not: the biological indicator, the chemical indicator, and the physical indicator. Next is the filtration, which helps to remove bacteria from heat, labile liquids like serum and sugar solutions, or the antibiotic containing culture media. Okay, all these can be filtered. They just remove the bacteria, not kill. As viruses pass through ordinary filters, it can be used to obtain bacteria-free filtrates of virus isolation. The membrane filters are usually of 0.21 to 0.4 micrometer in size, pore sizes, which usually filters the bacteria. There are different types of other filters like candle filter, asbestos filter, sintered glass filter, HEPA filter. HEPA is nothing but the high efficiency particulate air filter. As I said you before, the filtration and radiation can just remove, and 100% we cannot expect the sterilization procedure. Ethylene oxide sterilization, it has broad microbicidal action, including the spores that causes alkylation of cell components such as the cell proteins, DNA and RNA. It has three different phases: preconditioning phase, sterilization phase and the aeration phase. The effectiveness depends on the gas concentration, temperature, relative humidity and the exposure time. Usual gas concentration should be 700 milligram per liter. The humidity should be 40 to 80% and the exposure time need to be 4 to 5 hours at 38 degrees Celsius for 1 hour, or otherwise 1 hour at 55 degrees Celsius. What are the advantages of ETO is the large chamber capacity than plasma sterilization. It is suitable for heat sensitive items. High penetration power is there and it is highly diffusible. It can penetrate the areas that cannot be reached by steam. It is non-corrosive to plastic, metals and rubber materials. It will not leave any steam there. Disadvantages is it is highly inflammable, irritant, explosive and carcinogenic. ETO is usually supplied in a 10 to 20% concentration mixed with inert gases like either carbon dioxide or some other gases. Long duration of cycle, even 12 to 14 hours as the load increases. High cost of the instrument and consumables. Here again the control used is the Bacillus atrophius, the spores that is used as the control as a biological control. Plasma sterilization, it refers to the gaseous state consisting of ions or photons or free electrons or the free radicals such as oxygen or hydroxyl ions, and it needs plasma sterilizer, a device that creates a plasma which is said to be the gaseous state of the ions. It has two main stages: the vacuum, chemical sterilant injection and gas plasma generation. There is no final aeration removal step as like in ETO because there is no residual harmful agents that is resulting from the plasma sterilization. The cycle time is very minimal, 75 minutes. Here the advantages of using the plasma sterilizer is all the devices can be that cannot tolerate the high temperature and humidity of the steam sterilizer can be sterilized by this cold sterilization technique. Even the plastic, electrical devices, corrosion susceptible metals such as arthroscope, micro and vascular instruments, spine sets, laparoscopes, all these can be sterilized by the plasma sterilizer. And disadvantages, it should be dried before loading. The linens or the paper or cellulose or liquid cannot be processed. It may not penetrate the well, okay, especially in channels or devices designed with long lumens. It is of high cost. That is a disadvantage of the plasma sterilization. The disinfectants, other disinfectants, just to have a short knowledge about the disinfectant. The disinfectant, according to the Spalding's classification for the medical devices, critical, semi-critical and non-critical, the disinfectants can be classified as high-level disinfectants, intermediate-level disinfectants and low-level disinfectants. High-level disinfectants can be the haldehydes, the formaldehyde, glutaraldehyde, orthophthaldehyde, peracetic acid and hydrogen peroxide. The intermediate-level disinfectants are the alcohols, phenols, halogens, iodine, chlorine and hypochlorite solutions. The low-level disinfectants are usually the quaternary ammonium compounds or the chlorhexidine gluconate. Okay, we have some methods to check the efficacy of the disinfectants. For example, for the Chick-Martin test, capacity test, in-use test, radial Walker test, otherwise said to be the phenol coefficient test, all these are used to check the efficacy of the disinfectant. For the sterilizer, whether our sterilizer is working good or not, we have a physical indicator which is like a digital thermometer attached with the equipment. Next is a chemical indicator. With the color change, we can check whether the device is working or not. With the biological indicator like Geobacillus stereothermophilus or Bacillus atrophius, the spores which is used as a biological indicator will be checked for germination, and here again the color can be checked, or we have an auto reader to check the biological indicators for both sterilant and the disinfectants. Hope you understood the sterilization procedure, which is based on the new classification. So you should know mainly the definition, the classification of the physical methods and individual examples, especially the autoclave and the hot air oven is utmost important. You are supposed to know very well about the biological indicators too. So if you like the post, subscribe to the channel and click the bell icon. Thank you.